everyone, and welcome to the Doctor Show. I'm Dr. Zahra here, and we talk every Tuesday about the healthcare, the common diseases, and a lot of questions you've been wondering. So please, if you have any more questions or if you are wondering about anything you need to know about medicine, please find us on social media and ask away, and I'm always here to answer and always here to check your question. Today, we're going to talk about something very common that people have, and we don't talk about it quite enough, which is the diabetes mellitus disease, DM, or as known as diabetes. What is this disease, and why does it happen, and what are the types of diabetes, and how to prevent it, how to treat it, and how to deal with people that already have diabetes, especially if you have someone in your family that has diabetes. If you yourself have it, let's learn more about it to understand it, to know how to deal with it and prevent it. In order to understand what is diabetes, let's understand how does the body process our intake of sugar. So whenever we have any sugary food or sugary thing that we eat in our body, and also carbohydrates turn into sugar when we digest them, because their monomers are monosaccharides, and monosaccharides are basically sugar. So carbohydrates and sugar, when we digest them, they are built up in our blood. So the high level of blood sugar makes my organ called pancreas. The organ pancreas is basically a very small organ right beneath my stomach, releases a hormone called insulin. This hormone is basically a type of protein that goes to my blood and does a certain action. This insulin, the action of it is to lower the blood sugar in your body. So if I have a little bit of more sugar and I eat a lot of sugary food, the insulin gets released, it takes all the sugar away and lowers the sugar level in my body. Where does it go to? It goes to my liver and gets stored there as glycogen, as a substance called glycogen. So whenever I need it, when I have low blood sugar, when I'm not eating any sugar and my body needs it very well, what do? I have another hormone called glucagon. It actually goes to my muscles and liver, and it takes the glycogen away, makes them into sugar, and releases them into my body as glucose. So right now we have two hormones, insulin, which lowers the blood sugar, and glucagon, which makes it higher. Both of them work all the time to keep my internal environment constant, which is a word we use in medicine called homeostasis, which means everything in my body is always at optimum level, and all my internal environment perfectly fine. So why am I saying all of that? I'm saying all of that because when diabetes happens, there is no release of insulin, so the sugar builds up in my body, or sensitivity against insulin, or I don't have enough insulin to lower the sugar in my body. But why do I need to lower it? What happens if I actually don't lower it? Having a lot of blood sugar in my body is actually very toxic. It goes to every single organ in my body and tries to destroy it somehow, which causes something, could cause loss of sensation, could cause loss of vision, could cause a loss of my kidney function. So having a high blood sugar is definitely one of the most dangerous things that we have. So if I have I don't have enough insulin, I have diabetes. But in order to talk about what happens exactly, we have two types of diabetes. Let's talk about them very fast. First of all, diabetes type 1, which is an autoimmune disease. What does that mean? An autoimmune disease, it means my own immunity in my body, my own white blood cells. They mistakenly take my pancreas as something very foreign and dangerous to my body. So what does my body do? My body attacks the insulin-making cells, and I don't ever make insulin. So type 1 diabetes is actually a disease that happens very young age. People usually discover it very, very young because there is no insulin. So I'd have to realize it very early in my life, and I have to diagnose it very early in my life. And usually people, the cause of it is actually still unknown. We don't know it 100%. So usually it comes from a family history of someone having diabetes type 1. So if someone already has their relative or father or mother having diabetes type 1, they need to get their babies checked the second they're born. So what do we do if I don't have insulin at all? From the beginning, I don't have insulin. Can I stop eating sugar? No. Sugar equals energy in my body. Sugar equals energy. So I can't not have sugar in my diet. What do? I have insulin injections. If we know someone with diabetes type 1, it's actually a lifelong disease. They have to take insulin shots in their muscles before or after, depending on the type of insulin they take, every single meal during their whole day to the rest of their lives. So this is the treatment of type 1 diabetes. How does the person discover it? The symptoms would actually show to a baby increased thirst, increased hunger, excessive sweating, and could be going to the bathroom a lot, urination much more than often. So this is the diabetes type 1. It's actually only 10% of all the diabetes in the world. So thankfully, it's not as many as we think it is. But please, if you have a family history of diabetes type 1, and if you're having a newborn baby or if you're having a child, make sure to have to focus with their symptoms and diagnose them very, very early. What about type 2 diabetes mellitus? Type 2 is actually a self-induced disease, which means if I don't have a good, healthy lifestyle, if I'm above 45, if I'm actually an obese person, having an overweight makes me more susceptible to having diabetes type 2. If I eat very unhealthy food, if I'm physically inactive at all these are risk factors. If I already have other diseases, it's a huge risk factor of me having diabetes type 2. People usually discover it at very late stage or at an older age, above 60 or even 55, when they discover they have diabetes type 2. What are the symptoms that makes me know that I have diabetes type 2? It's the same as the young. It's increased thirst, increased hunger, going to the bathroom a lot, increased urination, being tired most of the time, and not having your wound heal very easily. This is actually one of the most terrible symptoms of diabetes. The wound healing, if you have any injury, the wound healing is very, very late, and it disrupts them into having normal surgeries, it disrupts them into having normal injuries. All of that causes you knowing that you might have diabetes. What do we do to make sure that we test it? We take a small prick in the finger, we take a drop of blood into a glucometer machine that knows exactly the amount of blood sugar you have. We can have fasting blood sugar test, we can have a random blood sugar test, and we can have a blood, like an actual blood withdrawal test called hemoglobin 1c. All of that can diagnose if I have diabetes or not. Of course, you need to go and check with your doctor if you have any of these symptoms, because it's very, very, very important to diagnose it early, because the complications are terrible. Now that we know that it's self-induced, it means you cause it to yourself if you're not having a healthy lifestyle. You need to make sure you have a healthy lifestyle, you eat all your vegetables and fruits and vitamins, you lower your junk food intake, you lower any fatty food, especially in our culture. Most of our food is basically just carbohydrates and fats, so we need to make sure to eat more protein and more healthy food, and most importantly, have a daily exercise. Even if half an hour walking, it's more than enough. So why do we need to prevent it? Because the complications are terrible. The complications are something very, very, very dangerous. Like what? What are the complications of both types of diabetes so far? Number one, heart disease, heart attacks, a stroke. All of that could be causing, diabetes could be causing them. What else? Something called neuropathy. Neuropathy means your nerves actually are being damaged to the extent that you will not have sensation anymore. Usually people you don't have sensation to their lower limb or some hands, or decreased sensation, so you will not be able to feel or touch things. You have nephropathy, which is a kidney disease that you might not have a perfect kidney function. You might have hearing loss because there are nerves in the ear that could go damaged. You might have something called diabetic foot. When you have foot ulcers and foot injuries, because it's in your foot, you're not usually going to feel it very well because you have less sensation, less pain, so the injury will get more and more and more. up to that it's going to be injured. All of it, foot damage, infections. Sometimes it could cause leading up to amputation of the foot. To this extent, they could cause damage because I told you before, the healing is much, much, much less. It could cause to skin conditions, bacterial infections. It could cause to depression and dementia, which is the loss of memory very early in your life. So all these conditions and all these risk factors, they're very, very, very dangerous for us not to go and check ourselves, get regular checkups. We've already talked about it in one episode that we need to check ourselves, our blood sugar every now and then to make sure we're fine. We need to have a healthy lifestyle. But don't worry, type 2 diabetes mellitus has a lot of drugs, like metformin is one of the drugs. You go to your doctor and make sure what drug suits you better, and you need to have lifestyle modifications as you need to have more healthy lifestyle and healthy food. The last thing I'm going to talk about is one type of diabetes that people don't talk about much, which is gestational diabetes. It means it's the diabetes that happens when the lady is pregnant. So in pregnancy, we might have a type of diabetes that usually don't have symptoms, but we do regular checkups to the pregnant lady and we discover it. It's okay, you don't have to worry. Most of the time, the diabetes goes away after the delivery. Some few times, very small percentage, it stays with them and becomes type 2 diabetes after that. But you need to get yourself checked if you are pregnant and you might have gestational diabetes. So that's all the type of diabetes. You should know how important it is to diagnose ourselves with this disease and how dangerous that disease is. And we should know that even if you have diabetes, you need to check yourself every few months to make sure you're doing fine. You need to have the glucometer at your home to do the blood test yourself. It's very easy to do it. You need to make sure that you are very healthy, very sound. You need to get yourself healthy food and exercise, and make sure you go to your doctor regularly. That's kind of it for today. Thank you so much for watching. Please stay healthy, eat healthy food, exercise, and I'll see you guys next Tuesday. Have a good day.